Hello, my name is Dwayne Graham. I'm an evaluator with the Department of Health and Human Services Office of Inspector General. Our mission is to protect the integrity of HHS programs as well as the health and welfare of their beneficiaries. Today, I'm going to be providing you an introduction on emergency preparedness. I'm going to first go over an OIG report and then talk about the 4 key federal agencies involved in emergency preparedness. This will help establish a foundation for other videos. These 4 agencies are the Centers for Medicare and Medicaid Services, the Office of the Assistant Secretary for Preparedness and Response, the Centers for Disease Control and Prevention, and finally, from the Department of Homeland Security, the Federal Emergency Management Agency. As we've all seen over the last year with COVID-19, any emergency, be it a hurricane, flood, active shooter, or infectious disease, can result in catastrophic consequences. These events often allow little, if any, time to prepare for an effective community response. That's why it's so important to dedicate time up front to adequately plan and prepare before a disaster strikes. We at HHS OIG have a large body of work in the area of emergency preparedness and response, including a 2018 audit of a tribal health clinic where we made recommendations regarding the facility's emergency preparedness program. Through our various reviews, we have found that strong emergency preparedness plans help mitigate catastrophic consequences and can prevent fraud, waste, and abuse of federal dollars. First, it's important to understand the federal government's role in emergency preparedness and specifically the 4 agencies involved. A recent OIG report on healthcare coalitions, known as HCCs, highlights the roles of these federal agencies, as well as recent community emergency preparedness successes and vulnerabilities. The report's title really summarizes the result of this work, that title being Selected Healthcare Coalitions Increased Involvement in Whole Community Preparedness, but Faced Developmental Challenges Following New Requirements in 2017. In addition to outlining the roles of various federal agencies involved in emergency preparedness and response, the report also highlights the importance of HCCs to plan for and implement a coordinated emergency response in the event of a public health emergency. 4 key federal agencies involved with emergency preparedness, which I mentioned earlier, are featured in this report. Again, these agencies are the Centers for Medicare and Medicaid Services, or CMS, the Office of the Assistant Secretary for Preparedness and Response, or ASPR, the Centers for Disease Control and Prevention, CDC, and the Federal Emergency Management Agency, or FEMA. Now, let me point out some of these agencies' duties surrounding emergency preparedness and response. Let's start with CMS. CMS administers Medicare and works with states to administer and implement other government healthcare programs such as Medicaid. CMS requires that healthcare entities meet conditions of participation, known as COPs, in order to receive Medicare and Medicaid reimbursement for the services they provide. COPs are a set of minimum quality and safety standards, and IHS requires its hospitals to comply with Medicare hospital COPs. In November 2016, new CMS regulations went into effect that included emergency preparedness COPs for other healthcare entities. These conditions of participation require healthcare entities to develop facility-based emergency programs that address how the facility will coordinate with other healthcare facilities during an emergency or disaster. For more information on these CMS requirements, see the CMS-related video. Let's move on to ASPR. ASPR is in charge of the medical and public health aspects of U.S. preparedness, response, and recovery. ASPR also provides guidance to healthcare coalition members on how to meet CMS emergency preparedness COPs and administers a cooperative agreement program for hospitals. This hospital preparedness program, known as HPP, is for national healthcare preparedness and promotes a consistent national focus to improve patient outcomes during emergencies and disasters while also supporting rapid recovery efforts. ASPR also collaborates with CMS to develop resources to support healthcare entities in complying with emergency preparedness COPs. These resources are available to healthcare coalitions and their members on the ASPR Tracy website. Next up is CDC. The CDC monitors and responds to public health emergencies, conducts research, and issues guidance to healthcare providers, government entities, and the public. Since 2002, the CDC Public Health Emergency Preparedness Cooperative Agreement, or PHEP, has provided a critical source of funding for state, local, and territorial public health departments across the nation, with a focus to build and strengthen their ability to respond to a range of public health emergencies. Since 2012, CDC and ASPR have aligned PHEP and HPP capacities and have established joint goals and activities to improve preparedness. The last agency I want to highlight is FEMA. FEMA is an agency within the Department of Homeland Security that works with local and state authorities to coordinate disaster responses. FEMA's Emergency Management Performance Grant Program and other Homeland Security grant programs fund state and local emergency management organizations. FEMA's core capabilities span the 5 mission areas of prevention, protection, mitigation, response, and recovery. FEMA also has a frequently asked questions tool on their website to assist tribes in determining how to request a presidential emergency or major disaster declaration independent from the state. In closing, I want to stress the importance of advanced planning and being prepared for an emergency. Fortunately, resources are available to support you and your organization's emergency preparedness efforts, including the CDC document, Public Health Preparedness Capabilities, National Standards for State, Local, and Tribal Planning, which can be downloaded from the CDC website. This guide can be used to help develop priorities and plans for building and sustaining emergency response capabilities. Another valuable document is ASPR's Healthcare Preparedness Capabilities, National Guide for Healthcare System Preparedness, available on their website. This document is a useful resource to assist states, tribes, healthcare coalition, and other partners in identifying gaps in preparedness, determining specific priorities, and developing plans for building and sustaining healthcare-specific capabilities. You can find links to these resources and others throughout this video course. For more information on effective emergency planning, you can refer to OIG's companion video, CMS Emergency Preparedness Rules in COVID Response.